administration versus COVID-19, communicative failures and successes amidst crisis. And this is by Kayla, Butler, Sarah Douglas, Madeline, Haak, and Raven Nobles. Here we have some what we call calculations behind the crisis. You see these numbers and they're very big, very big. How do you quantify, with respect to these numbers, loss of family members, loss of jobs that lead to financial struggle that sometimes can't be recovered from? You can't really quantify that. You can quantify all these things, and these are all relative to the US, by the way. You can quantify these things, but you can't show their full effect and the effect they have on people and people's lives. We mostly employed this slide to show that what we're dealing with here with COVID-19 is a crisis. Big numbers lead to big problems. They indicate big problems, and big problems call for solutions being implemented, usually big solutions. Our project focused in on the Trump administration's approach to these problems, this crisis, and we're going to delve into how that administration dealt with COVID-19 and what they could have done better to restore their image and their actions, and what they may have done well enough.
Within this case study, we wanted to focus on President Donald Trump's administration due to the pandemic happening during his regime as president. And through looking at the crisis through the lens of image restoration theory, we came to the conclusion that President Trump focused on denial, corrective action, and reduction of offensiveness.
This is a projected timeline that Stanley Morgan and Company came out with of what they thought would happen during the crisis. The U.S. wasn't as prepared as we should have been, given that we've been through past crises before. We have the Zika virus, which first came out in 2007 and reappeared 6 years later. And it took the CDC a few weeks to come out and tell the health that it was a public health crisis. Then there was the swine flu, which happened in 2009 in early April. And it took the CDC and the WHO. They didn't come out and declare it a pandemic until June 11th. So it was quick, but not as quick as it could have been. And then the last one I researched was the Ebola virus. The first case was seen in 1976, and then it arose again in 2014. It took 3 months later and 5 infections before the WHO announced it to be a public health crisis to the public. Given this, the US should have used this and been more prepared for COVID-19.
Specifically within our case study, we looked at the Trump administration as a leadership organization. We looked at what Donald Trump and his administration employed through his communicative leadership, and we focused on the scrutiny and praise that Donald Trump received while he was in office during the COVID-19 pandemic. We wanted to further understand his communicative process and how he had delayed a lot of the roles he had as president during the pandemic. However, we also wanted to look at how within his administration he was able to produce communication that was both informative and allowed the public to know what the United States government was planning to do in the face of this crisis. And while COVID did not have any one person to blame, that doesn't matter within image restoration. Whenever you communicate something, you can't take it back. Communication can't be reeled back in. And President Trump expressed this whenever he was in office. This image shows one of the events that President Trump had while he was in office during the pandemic. This shows who tested positive during the after the event. He did not have masks, he did not have social distancing, and within this, President Trump communicated that he did not necessarily care about what the virus at the time, and maybe he did not mean to show the world, to give the world that perception. That's what happened. And so within this image, you can see who had tested positive after the event occurred. And after the event occurred, Donald Trump did he sent out apologies and he got tested. However, this use of reduction of offensiveness did not necessarily work, because what he did was offensive to the public as a whole.
Okay, so the Trump administration's response used denial, reduction of offensiveness, and corrective action. In denial, he halted the funding of to the World Health Organization. His administration and him, Trump made a statement saying that the World Health Organization was the one responsible for all the deaths of COVID, and he says that they basically downplayed COVID. This is a version of denial you can use. I don't think that he used it very well, because it's not professional to blame a organization for that amount of deaths, especially because you shouldn't blame anybody for the pandemic. And as the president, that's just a little unprofessional. He also used reduction of offensiveness after he referred to COVID as the Kung flu or Chinese virus. He made a statement saying, oh, well, that's just, 2 of the names we use. There's 20 different nicknames. In some instances, being casual about situations is okay, but in this instance, blaming a whole race for a virus and then turning around and saying, oh, it's nothing, just isn't good for the president of the United States. There's some other ways you can go about it. And then for corrective action, so whenever the vaccines first came out, he ordered 100 million doses of the vaccine. And then if those worked, he had another order for 50 million. This is a good way to use corrective action by providing what Americans are looking for, because before that, he made a statement saying he wasn't going to support the vaccine. So him turning around and doing that is nice, and it shows that he's there to help. And then he did test positive for COVID-19, and he attempted to use corrective action by showing that he was quarantining, and then a few days later, his physician made a statement saying that he tested negative and hadn't had a fever for 24 hours. But on the contrary, he did not provide actual proof that he tested negative. In the Trump administration, White House, everybody said that they didn't have one. So yes, he tried to use corrective action, but he did not use it in the right way.
So we keep talking about COVID. It's not just something that required all of us to wear masks for months. It's not just that. I'm just going to give a little bit of a brief of what it is, just so we understand why vaccines are being produced and how they will help and that sort of thing. So COVID is a respiratory virus. We know it's spread through our droplets in our mouth and our nose when we respire, breathe, anything like that. We know that it's an mRNA virus, which means that it has some sort of role in the translation of DNA to proteins. And proteins are very functional within our bodies, so we know that it affects some type of functioning. Well, these vaccines that we're generating, the goal is for them to induce the production of a protein that will then call for the immune response within individuals to be heightened and act against COVID, which we've already talked about this a little bit. Sarah did in her slide, that President Trump referred to it as an Asian virus. It did originate in Wuhan, China, and we think its origination was in a market and in some sort of animal, and it jumped from animals to humans. So that's just kind of a general idea of what we're talking about when we talk about COVID.
Ethically, Donald Trump did not necessarily respond to COVID-19 as he should have in the beginning. As this slide states, immediacy is key. And within certain areas of the pandemic, Donald Trump did not act as a president necessarily should have, especially when referring to the pandemic as the Kung flu. That was extremely insensitive and unethical. And with his withdrawal from the World Health Organization, that also displayed his social responsibility in terms of the crisis. Whenever we're facing a pandemic, it's good to have the opinions and the regulations and the thoughts of other world leaders. And President Trump did not necessarily have this whenever he withdrew from WHO. While his major goal for his campaign was America First, withdrawing from WHO did make sense, and many Americans were proud of him for doing that. So it's kind of, you have to look at both sides of the coin and understand where you fall on the political spectrum and how much governmental power you want the government to have, how much social responsibility you think that they should have. And within his display of social responsibility by buying all of the vaccines, he did make sure that the Americans knew that they were going to get the vaccines.
And just to elaborate on some of what Raven said, we have this point here that says denying the existence of a problem is not the only method to reassure people. President Trump may have had some type of ethical fuel running his initiative to use denial as an image restoration tactic, because he may have been thinking, okay, well, I'm going to deny that this issue is of a certain magnitude so people do not freak out. So we don't want to send people into a frenzy when we have a crisis. That's the last thing we want, because yes, crises are uncharted territory, but you still have to face them with caution. You can't just go in and act like they're not a big deal. But there probably was some sort of ethical fueling behind that action of his. And, oh, hold on. It didn't let me go. Okay, sorry, y'all. 1 second. Okay, there we go.
Okay, so the U.S. should have been more prepared, but because the Trump administration denied severity of COVID-19 for so long, it prolonged testing to be sent out, and it prolonged the U.S. to stay in a panic for longer.
And right here we have this little quotation that we kind of elaborated on, just the whole theme of our paper, of our project, of the case study. Worry is the advance price you pay for troubles that may never come, but sometimes it's good to pay in advance. And what we mean by this is that sometimes when you're in the business of leadership and you're in the business of representing a people, you have to stress a little bit before something is actually a big deal. So maybe Trump could have done better if he would have treated COVID as the big deal that it eventually became. When you're in government, this is one of the main things you have to do, is you have to represent a people and you have to keep in mind the needs of your constituents. That's the main thing.